Hi, you're welcome back to the Woman Show. My name is Akia, a nurse by profession, and also I'm an advocate for early detection of cervical cancer. Well, if you haven't subscribed to this channel yet, please do subscribe now. Before we continue to subscribe, I'm actually waiting for you to subscribe so that I can go on. So please do subscribe. Also, you can like and then you can leave your suggestions or comments down below the video. So do stay tuned as we get on to today's episode. Today is more of an open discussion and just a tidbit of how you normally would treat a newly done piercing. So I got approached in my direct message on my social media on how someone would need or someone would have to treat their newly done piercing for it to not have infection or go bad. Okay, so right from the start, I need to get this thing out. If you're going to do a piercing, first you need to read on wherever you're going to get the piercing done, be it your ear, your navel, wherever you want to get a piercing done. Please do read on it. Be well versed with anything you need to know so that you prepare yourself psychologically or emotionally for it, especially with the pain or however preparation you need to do when you get it, and then you need to attend to it so that it doesn't become a burden and then it also doesn't get infected. So after reading on it, you go get your piercing done, come back. Now a lot of people have their those that normally pierce for them, telling them to take antibiotics to prevent them from not getting the infections. Antibiotics mostly are taken after there is an infection by the bacteria. You don't take the antibiotics before you get however infection that it is. It's normally not advisable to do that. So I would advise that those that are being taught that or being told that to refrain from taking the antibiotics before they actually start getting the infections or whatever it is. Now, what you can actually take is vitamin supplements. So if you're taking the vitamin supplements, what the vitamin supplements would do is it would increase your body's mechanisms, or let me say your body's ability to fight off infection. So once you have a lot of vitamins in your system helping your body mechanisms work properly, it will just take off naturally because your body is already immune, or let me say close to immune or immune to infections, because the system is having a very high healthy scheme. So there's no way that you are going to get infection, or even if it's infected, there's no way that it's going to be so high or so huge for you to contain. So when you get the piercing done, right, one thing you need to do is make sure that you're not putting dirt at the area for the piercing. Make sure you're not putting dirt there. If it's your navel, just make sure that it doesn't come into contact with anything dirty. Like, you don't touch it with your bare hands. If you're going to touch it for any particular reason, wash your hands before you touch it. Also, you need to know, especially with the piercings done, the extra piercings done on the ear, you need to know that the pillows that we sleep on, they have microbes and all those animals all those animals on them. So once you get a fresh piercing, you would need to cover up, or maybe change your pillow covers or something, just to make sure that it doesn't come into contact with anything dirty. Then in treating the wound, or however it's called, if it's a wound or hole, or in treating it, mostly the go-to is salt solution. And I don't know how you do it, but some people would get a bowl, get water, put in the salt, then use a towel to just tap it, or if it's on your navel, tap it. If it's your nipple that you pierce, use it to tap the area of the piercing. So you do that frequently, like morning and then evenings, until you see that the place is neatly closing up. You don't just do it like 2-3 days and then you just stop. It normally takes longer periods of times before piercings heal. Tongue piercings can take up to 1.5 years, sometimes 2 years before they heal. With ear piercings on the cartilage, mostly it takes about 3 to 6 months before it heals. Where else? The navel takes 1 year to 1.5 years before it heals. Most of the places, she mentioned, the lady that approached me mentioned that she was told it's supposed to heal by the 2nd month, which is quite true in a way and untrue in a way, because every human being and their healing mechanism, like how best my piercing will heal is different, or will be different from how best someone else's piercing will heal. So you don't just say that something will heal in 2 months, but averagely it takes about 6 months for these piercings to heal. Some people also have keloids. So before you also pierce, check in your bloodline, in your family, to see if you have keloids. If you have keloids, it's not advisable to pierce, because once you pierce and then it causes trauma to the area of the piercing, then you develop the keloids, and then that also wouldn't look quite pleasing to you. So please make sure you know where you're coming from before you do anything. I think that's basically it for taking care of the piercing. After it gets infected, I wouldn't advise that you continue to keep the piercing. If it's still there and you would want to keep the piercing, I would advise that you see a physician or a doctor to help you go about it. If he's going to prescribe antibiotics for you, or he's going to let you dress the wound using like antiseptics and any form of ointment to dress the wound, that's also fine. So once it gets infected, you need to see a doctor to help you. So yeah, that's basically it for keeping freshly done piercing, right? This brings us to the end of today's episode. If you're still here with me and you haven't subscribed, please do subscribe, and also like the video if you feel it was informative or you liked how I put this together. Like the video. You can also leave your suggestions, and you can also leave your comments down below. However, you can approach me on any of my social media outlets if you have a personal issue, and I would attend to that personally for you without letting anybody know. So thank you for coming here, and do have a lovely day. Bye.